Hi, this is Hannah Furchess, and I'm going to be doing a video about the issues with immigrants having access to food assistance, housing assistance, and health care, and being able to function in our society in the United States. I got most of this information from an article posted from the usnews.com titled "Crackdown on Immigrants Who Use Public Benefits Takes Effect," and it was published February 24th, 2020. Federal law requires that people who are seeking permanent residency or legal status in the United States, they have to prove that they will not be a burden to the U.S. New rules implemented by President Trump included a wider range of programs that could disqualify them, such as if they use Medicaid, food stamps, housing vouchers, any type of assistance programs. It can disqualify them to get a green card or become a legal citizen. These guidelines also are scaring people because they want to be a citizen, they want to be legal, and to stay here and not be deported. But since Trump has cracked down on this, they are afraid to use these benefits to get resources for food and housing because they know it's going to hinder them from getting a green card. So a pastor in Phoenix, Arizona, said that the Trump administration cracking down on the immigrants has made people not show up anymore. He said people would line outside the doors waiting to apply for food stamps or WIC or housing assistance because they were trying to get on their feet while they're in America, and they're not able to because now they're scared that if they show up and apply for this stuff that they're going to get deported. So now the pastor said that outside of this state office, no one's showing up, and it used to be wrapped around the building with people. This pastor stated that this act by Trump will bring more poverty, more homelessness, and more illness to the Spanish-speaking immigrants in the Phoenix area. The White House said that these guidelines were put in place to safeguard welfare programs for truly needy American citizens, reduce the federal deficit, and reestablish the fundamental legal principles that newcomers to our society should be financially self-reliant and not dependent on United States taxpayers. I chose this news report to bring awareness on the fact that it is difficult for immigrants to gain access to health care, food assistance, and housing because they have to prove they will not be a burden to the U.S. in order to get a green card or become a citizen. President Trump is the one who has cracked down on these guidelines. These regulations make it almost impossible for immigrants to come here and to build a thriving life and to be able to pay taxes and work and function in our society. Many people complain about immigrants not paying taxes, but how can they when they are struggling to gain citizenship to be able to work a legitimate job and file taxes? This is America, which is supposed to be the greatest nation and land on earth, and yet we do not support immigrants coming to our country and to provide a better life for themselves and their families, and we don't even want to provide resources for them to feed their children. We are falling far from being the land of the free and having human decency. Children will be going hungry and going to school sick due to the lack of assistance, and families will be starving and living in unacceptable conditions. I dug into some historical acts that have been put in place over the past few hundred years in the United States, and a couple of the things I found were the Alien Friends Act of 1798, which authorized the president to imprison or deport any alien who was deemed dangerous to the United States. This act was the first to authorize deportation for immigrants, and it expired 2 years after it was enacted. Another act I found was the Immigration Act of 1864, also known as an act to encourage immigration, to address the labor shortages that came from the time of the Civil War. This act was made to provide contracts for immigrants to labor and work for the U.S. courts. It also created a commissioner of immigration appointed by the president to serve under the Secretary of State. There was another agreement called the Bracero Agreement. It was an agreement with the U.S. and Mexico to permit Mexican nationals to serve as temporary agricultural workers during World War II because we had labor shortages in the United States. And it required employers to pay an equal wage to what was paid to the U.S. Farm workers and to provide transportation and living expenses. And that ended in 1964. And then we have the Refugee Relief Act from 1953, which authorized special non-quota visas for more than 200,000 refugees and allowed these immigrants to become permanent residents. We have the Migration and Refugee Assistance Act. In 1961, President Kennedy put this into place to create a program that provided medical care, financial aid, education, welfare services, and resettlement for Cuban refugees. We have the Illegal Immigration Reform and Immigrant Responsibility Act, which increased enforcement at the border, including mandates to build fences and to remove criminal and deport aliens, to tighten the admissions eligibility requirements. So we started blocking off people to come into the United States. We also have Enhanced Border Security and Visa Entry Reformed Act. We had the Homeland Security Act, which was put in place after 9/11. And then we have some change that became better to executive actions that were put in place by President Obama while he was in office. He created the Deferred Action for Childhood Arrivals and the Deferred Action for Parents of Americans and Lawful Permanent Residents, the DACA program. Through this action, young adults 15 to 30 were brought to the U.S. illegally as children, were able to apply for temporary deportation relief and a 2-year worker permit. And the second action that he put in place allowed unauthorized immigrant parents who lived in the U.S. For 5 years to have children who are U.S. citizens or legal permanent residents to apply for deportation relief and a 3-year work permit. So it seems that, looking back through history, we used immigrants for labor and work. Can't really call it slavery because they were paid, but we were still using them for their services. And, they helped us out in our time of need with the Civil War and World War II. They worked and helped us rebuild. And now we don't even want to allow them to live in our country. Health equity relates to this because it implies that everyone should have an opportunity to attain optimal health and that no one should be disadvantaged. This means all people, and Trump is trying to take that away from immigrants who are people just like me and you. Social determinants of health are the factors that play a role in our health outcomes, such as economic stability, health care, socialization, community, education, neighborhood, and living environment. This relates to the issues that I have discussed in this video because immigrants cannot have positive outcomes with these social determinants due to the struggle to become a legal citizen and get health care, have a stable job, receive education, and be able to live in a decent home. Social justice means equal rights and opportunities for all people. This includes health, and immigrants are scared to even apply for food or housing assistance out of fear they won't qualify for a green card or citizenship and will be deported. So they are suffering from the lack of food, adequate housing, health care, and jobs. In relation to the public health intervention wheel, I chose advocacy as an important intervention on a community level. An example would be advocating for the Hispanic and Latino community that is trying to get a green card or government assistance to build a life here. The nurse can advocate by getting involved in politics, creating awareness to these issues, voting, and getting involved in relief programs such as nonprofit clinics that help immigrants receive food and healthcare services.